Good morning, good afternoon, and good evening. Welcome to the 565th day of continuous Zoom session of IFPH. Today, our guest is Dr. lUBNA KAMAL, MD Homeopathy, MBA, PhD. Homeopathic nephrologist treating renal failure and other patients suffering from other chronic illnesses since last 2 decades. We all know that is a very important topic, renal failure. The cases are on the rise day by day. The only solution, as the allopathy says, only the renal transplantation, and always seeking for those who donate the kidneys. So many social problems are all created by these renal transplantations. So very important topic, role of management and diet in treating renal failure. On behalf of IFPH, I am welcoming you, Dr. lUBNA KAMAL. You can have the platform for next 45 minutes. Over to you, Doctor.
Hello, everyone. This is Dr. lUBNA, and we'll be talking about the importance of management in treating renal failure. See, what we do with homeopathy is we try to cure the patient or improve the symptoms, but management is different from medication, and management is auxiliary to that, and it is equally important because we as homeopaths do not fail in selecting the simillimum or prescribing the right medicines. What I have seen in my clinical practice is that the most homeopathic doctors do not know how to manage a chronic case, and especially patients suffering from liver cirrhosis, cancers, and especially this renal failure. So I'll be speaking about specifically about renal failure today, and regarding the rest of the topics we'll discuss later on. So the most important thing to for a patient of suffering from renal failure is the management of their blood pressure. Now, in most of the cases, actually, the blood pressure is raised. That is usually the first symptom we come to know of. The patient usually reports with high blood pressure, and then when we get it checked again and again, we find that despite medication, it is not reducing. That is usually what happens with the patients of renal failure, that without despite medication, it is difficult to bring down the blood pressure in normal range. So when such patients go for their creatinine test, then we find that it is raised. So the most important thing is the management of blood pressure, because without managing the blood pressure, we cannot control or reduce the creatinine or improve the patient of suffering from renal failure in any way. Now, how should we treat this blood pressure? First of all, there should be regular monitoring, and we should see the trend of the blood pressure. When is it increasing? When it is decreasing? It is continuously increasing. What is the trend? Then in the initial, what I have found in my clinical practice is that initially in the initial stages of blood pressure, it is okay to give homeopathic medicines like Rauwolfia, Crataegus, Strontia, etc. But when the blood pressure in itself is chronic, it is persistently rising, or it is persistently there, or the blood pressure medications are needed to be increased, or the salts need to be regularly changed, then we should not try to give homeopathy in that. Then we should switch to allopathic or the modern medicines, and we can refer a patient to the nephrologist, and they can prescribe the various medicines available amongst them, whichever they feel is useful. Now, speaking of the blood pressure medication, there are few I would like to discuss. The first are the diuretics, because see, a homeopathic doctor too needs to have first-hand knowledge of all these allopathic medicines as well, because in some cases the rise of creatinine is because of the allopathic medicines that the patient is taking. Sometimes they take it indiscriminately. Sometimes they do not consult a nephrologist. They are taking medicines from some quacks. So we have to guide the patient regarding that. The first in line of the treatment available for blood pressure is the diuretics, the Ditor and the Lasix, which we commonly know, and they are responsible for the reduction of the blood volume. They reduce the sodium and the fluid content from they remove the excess of fluid and the sodium from the body. But the overuse or indiscriminate use of diuretics is very harmful, as it may lead to dehydration, and ultimately it damages the kidney, it harms the kidney. And sometimes the rise of creatinine is because of this only. Then second are the beta blockers, which act on the heart. They reduce the heart rate and the blood volume, which in turn leads to lowering of blood pressure. The third are the ACE inhibitors. For that, I would like to discuss this RAS, or renal angiotensin aldosterone system. So whenever there is reduction in the renal blood flow, when the renal blood flow, the blood flowing into the kidneys is reduced due to this juxtaglomerular cells in the kidneys, the prorenin is converted into the renin in the blood, and the renin actually converts the angiotensinogen into angiotensin 1, and then angiotensin 1 is converted into angiotensin 2 and angiotensin T3 by ACE. So these ACE inhibitors, they reduce the renal function. And then the fourth class of the blood pressure medication is the angiotensin 2 receptor blockers. Then fifth is the calcium channel blockers. Then there is the alpha blockers, vasodilators, alpha-2 receptor agonists, and the central agonists. Now, the most important thing to understand here is that sometimes in the end stage renal disease, that is when the GFR is really low and the patient is dependent on renal replacement therapy, that is the dialysis or the transplant. If the blood pressure is uncontrolled, even by various medications, I have patients who take numerous medicines for blood pressure at the same time, 6 or 7 pills just for blood pressure, and still it is not controlled. Then is the last, this medication, the central agonists are used, which act on central nervous system and not the CVS. So it is best to give those medicines, and which bring down the blood pressure. It can be given 2 or 3 times a day, but it has to be, if the blood pressure is okay, like later on in life, if it becomes okay, then these medications cannot be stopped at once. They have to be gradually tapered off. You take away one of the pill and then gradually reduce the dose. And another important thing regarding blood pressure is that if you have selected the right similimum, suppose you are giving several medicines, and if you have selected the right similimum, then automatically the blood pressure would improve, even if the creatinine level does not improve, or if apparently the patient is not better, and if the blood pressure is better, then you can be sure that the selected similimum is the right one. So this was all about the blood pressure. The second most important thing is the control of blood sugar levels, because most of the patients with diabetes mellitus with uncontrolled blood sugar, they develop renal issues later or sooner. So regarding this diabetes, there is this type 1 diabetes, which is absolutely insulin dependent. And then there is type 2 diabetes. Again, I would say that if the patient is in initial stages of diabetes, it can be controlled with homeopathic medicines. Both there are tinctures, Syzygium, Gemnima, several other medicines, the insulin triturations, the uranium nitricum, and then the constitutional medicines. But if the blood pressure, if the blood sugar isn't going down, then we cannot keep on experimenting with our medication. The blood sugar has to be within the normal range, the HbA1c within 6. So for that, if the patient is required to take allopathic medicines, then we should not stop. And there are several medicines to control the diabetes. I would name some. The metformin is the first and the safest amongst oral hypoglycemic drugs. It is relatively quite safe for renal patients, and usually this is the first in the choice of medications. But again, if the blood sugar level is not coming down, and or if the patient is under a lot of stress, or if they are not following the dietary precautions, then ever increasing doses of even metformin would cause harm. The second are the sulfonylureas, glinides, DPP4 inhibitors, GLP1 receptor agonists. Then there is SGLT2. Last of it is insulin, which I have found to be most safe for kidney patients. Suppose you have a kidney patient and they want to go for allopathic medicines for diabetes. It's safe to say that if they switch to insulin, they are the safest medicine. I mean, the insulin is the safest one because it is least harmful to the kidneys. Then these were the first two things which have to be thoroughly managed, without which we cannot think of even controlling creatinine or the renal failure. We cannot stop it from progressing. The third important thing is the infection. Now, this infection, however slight it may seem, even if there is slight cough, viral fever, maybe some tooth, dental problem, dental issue, some gastrointestinal issue, it will increase creatinine. The renal function might not be lost, the renal cells might not be lost, but if there is slightest of infections, it may lead to little rise of creatinine. Then if there is a severe infection like pneumonia or like urinary tract infection, that is very tricky to treat, the first thing. And we should be very, very careful, because usually what happens is like there is slight UTI and it blows out of proportion within no time and it leads to septicemia. So the patient who came to you with chronic kidney disease, he is having now this UTI, urinary tract infection. It may blow it into acute on chronic kidney disease. It may cause the creatinine to rise immensely. Like if the patient was at 3 or 4 creatinine, urinary tract infection may cause it to rise beyond 8 or 10 or maybe 12, which is when dialysis becomes essential. So I have treated a lot of patients with these kind of infections, and in most of the cases, I would say that they were improved. But one should not experiment beyond if the TLC is continuously rising and subsequent readings after 3 or 4 days, we get it checked. If it is subsequently even rising, if it keeps on rising, then we should ask the patient to switch on to antibiotics and taking the help of a specialist. But there are few antibiotics which are very harmful, like vancomycin and aminoglycosides, which lead to rise of creatinine and loss of renal function. Then there are other medicines as well, which are very, very harmful to the kidneys, because you are giving the similamum to the patient, you are expecting improvement or maybe cure, but the patient is not responding to your medicine. So we have to be very sure that there is no other reason for the creatinine to rise. So these non-steroidal anti-inflammatory drugs, they are very, very harmful to the kidneys. Then these proton pump inhibitors, they have proven to be detrimental to the kidney health. They are very harmful, and it's long use. One of my patients, it was discovered that his mother was taking these PPIs for 10 or 12 years, and that led to the renal failure. Then there are some laxatives which are very harmful. Some kind of, at times patients are taking some kind of churn or some Ayurvedic preparations. So that has to be kept in mind while prescribing, that they have to be stopped while treating, because they may also lead to renal damage. Then there are few anti-obesity drugs in the markets nowadays, which are again very harmful. Then the patient should not be taking protein supplements or these herbal supplements to reduce weight, because again they at times lead to rise of creatinine. Then some of the antifungal medicines, the modern medicines, antifungal medicines are very harmful. So they have to be stopped, because sometimes the patients come with skin troubles as well. They have renal failure and then they have skin troubles, and they are taking antifungals. So you have to ask them to stop those and be on homeopathy. And it is best to advise them to apply coconut oil on the skin, which may give relief. Then statins, which are used to control cholesterol or triglycerides, they are also extremely harmful, and they may be the sole reasons. They may be the sole reason for the rise of creatinine in some patients. So all the medication that the patient is taking, they have to be very thoroughly examined. And again, they have to be reviewed. Like if the patient is consulting a nephrologist, a cardiologist, then a homeopathic doctor should go through the prescriptions and the medicines. Again, I would like to quote a patient. He was working with the Oriental Bank of Commerce. He was a manager over there, and his creatinine was pretty stable with homeopathic medicines. It was 4 or 5, and then it came down to 2 or 3, and the patient was absolutely all right. And then what happened was that all of a sudden his creatinine was started to rise. It came to be 6, and then 7, and then 8, and it was just rising like anything, and we could not do anything at all. So I just asked him, what have you done in the last 1 or 2 months? The patient was also clueless about it. So then once he told that, oh, I had an angina once, and I went to this King George's Medical College. There's this Lari cardiology. They took my ECG and all, and they found something, and they gave me few medications. So I asked him to give me the prescription, which he did later, and I found out that he was like taking at least 8 or 10 medicines for that. So I checked with the dates, and it was both of the things coincided, that the moment the week he started taking those medicines, it was from that moment onwards his creatinine started to rise. So I requested him to stop those medications gradually, and automatically the creatinine started to come down. So all the medications, I would request again, all of you who are suffering from renal disorders, listening to this program, and all the homeopathic doctors watching this, please be very careful of all the medications you are taking. Now, the next thing is obstruction in the urinary tract or the urinary passage, which is very, very important, because if there is any obstruction to the outflow of urine, it will create back pressure on the kidneys, and again, it will lead to loss of renal function and rise of creatinine. Now, there can be obstruction due to various reasons. In men, elderly like men, it is benign hypertrophy of prostate is very, very important. Then the renal stones, especially the Staghorn calculi, are very important, because if you are treating a patient with high creatinine and if you're not doing anything for the stone, obviously you'll not be successful. The creatinine will not reduce. Then if there is cancer, if there is CA of any part, which is leading to obstructed urine obstruction in the urinary tract, or there is some impedance to the flow of the urine, again, that would cause the rise of creatinine. The other thing is that the stricture is very common. So without treating, we can, the homeopathic doctors can bring about a little relief in the stricture cases with thiocinaminum and the thuja. I have found them to be extremely useful. There was a case with stricture. I think he developed it later in life, somehow, maybe because of some catheter insertion or whatever may be the reason. There was this stricture, and the urine was not able to flow properly, and we started with this medication, the thuja and the thiocinaminum, and gradually it loosened, and the urine could flow more easily, and the pressure of over the kidneys, it got reduced, and the size of the kidneys, the hydronephrosis that was there, that had also improved. So this the obstruction to the urine, it has to be something to be dealt with. For BHP, there are a lot of medications like acid phos, then sabal sarolita, thuja, conium. There are a number of medicines which are very useful for BHP, treating BHP. Then stone, even for huge stones like 20 mm or maybe over the size, I have found Berberis vulgaris and Sarsaparilla tinctures to be extremely useful. And if there is nausea and vomiting associated with that pain, Nux vomica in high potencies become very useful. It just simply acts like a stone cutter or stone breaker. So there was a patient with a large stone, and he was having this nausea constantly. I gave him Nux vomica every night, and the stone, he got rid of the stone, I think within 15 or 20 days. So homeopathy has a lot of scope over there. Now moving to the next part. The things in the blood we have to manage, or we have to keep an eye on. There's this serum uric acid. Its level usually should be within 6 or 6.5, but in patients suffering from renal failure, it may rise up to 10 or even 11, and then it crystallizes in the kidneys, and it leads to so many problems. But the medicine available, the binder, the allopathic binder that is available for this uric acid, is again harmful for the kidneys. The xyluric, which we fabric, or the xyluric which we usually use or our patients are already taking, that is actually very harmful for the kidneys in the long run. The patient cannot be kept on that medicine for a very long time. So for that, in order to maintain the uric acid levels in the blood, if it is very high, obviously it is okay to give allopathic medicines, the one the nephrologist have might have prescribed. It is okay for the patient, but once it comes down to 6 or maybe 7 or within the normal range, then we should try to treat it with homeopathy. And there's a patient of mine in USA. He is like 75 years old, and he had terrible pains because of this gout. So I asked him to get those tests, which in US it takes very long to get all the tests done and all, for the reports to arrive. So initially I prescribed him this Rustox and Macfos, and his pain was okay. But it was found that his uric acid is high, and the doctors were very honest over there. They said that we do not want you to give allopathic. We do not want you to keep on allopathic medicines, and you can explore other options. So he asked me, and I prescribed him uric acid in 30. And till date, he never had that episode again. It was such a big relief to the patient that he never had to go for any painkillers, any kind of that gout episode. He would just adjust his diet and keep on taking uric acid 30 off and on, which gave him immense relief. So even we can do that with to the renal failure patients if there's tendency to be for the uric acid to be very high. Even acid bends is very useful. Acid bends in 30, I found it to be very useful to control uric acid levels. Then there is this calcium and phosphorus levels in the blood of the renal failure patients. So calcium level actually, usually what happens is the calcium level drops below the normal, or and the phosphorus level rises. And there is this whole parathormone, or the parathyroid hormone, and the vitamin D. There is this whole cycle. When there is this reduction in the ionic calcium levels, then this whole cycle gets activated, and there's resorption from the bones, and then the phosphorus level rises. So for calcium, if it is too low, like if it is around, if the serum calcium is around 8, we can give calcarea phos. Otherwise, if it is lower, then we should not experiment further, because the good amount of calcium is required, around 500 mcg per day. So usually we recommend this Shercal and all. But along with that, I mean, we cannot just see look at the calcium levels. We have to look at the phosphorus levels also. And to reduce phosphorus, there are the phosphorus binders, which are very effective. And one thing with the phosphorus binders is that it has to be the tablets have to be crushed, and they have to be had together with meals. It is it gives the best result when in between the phosphorus binder is taken in between the meal. So that is the trick. Sometimes the patient is taking like 3 medicines, the phosphorus binder 3 times a day, but the phosphorus level is not reducing, and the patient is might be having bone pains or itching all over the body because of high phosphorus levels. So it is a good practice to give to crush the phosphorus binder and to give it with the food in between the meal, right in between. And for this now calcium has to be given with vitamin D, and the vitamin D level has also to be checked. And if it is lower, it has to be supplemented from outside. Like there has to be supplement has to be provided. Now, iron or the HB hemoglobin level, this is a major problem. Anemia is a very severe problem, especially in end stage renal diseases. I've seen patients, sometimes they come with hemoglobin as low as 3 or 4. So that has to be taken care of immediately. And erythropoietin injections are given to the patient. But I would say that if the constitutional medicine is correct, hemoglobin starts to rise. It may rise by 0.2, 0.5, or maybe just by 1 unit, but the hemoglobin levels start to rise with a perfect this simillimum. But otherwise, the iron supplementation has to be done with the along with the folic acid, and if it is really low, then erythropoietin has to be given. And if it does not rise, because at times, even with the best supplementation, even with the best of injections, even with the frequent doses, still the hemoglobin level does not rise, then the patient has to be transfused. Blood has to be transfused, because if it is lower than 5, it leads to several other complications. And but we have to be very careful while transfusing a patient, or asking the patient to get blood transfusion, because it might increase the blood volume, and that might land the patient into another trouble. So usually what is done is, in end stage renal disease, such situation usually occurs in the end stage renal disease only. And then what we suggest to the patient is to get the blood transfused along with dialysis, so that there is the balance, so as to maintain that balance. Then the bicarbonate ions, they are also checked, because it leads to metabolic acidosis or alkalosis, and they are balanced by the kidneys itself. So if the kidneys are not working properly, there will be this imbalance of this, and it will lead to several other problems. Along with this, there are several other electrolytes like sodium, potassium, and chloride. They have to be kept within the range. And the most important in all of these things, the most important, I would say, is the potassium, especially in elderlies, because if the potassium is high, I have seen in cases like even the potassium was just 6. Usually it is 5 or 5.5 is the normal range, and it touched 6, and the patient landed into atrial fibrillation. So potassium is something which one has to be really, really careful about, because that is which causes the emergency in a renal failure case. The creatinine, the rise of creatinine might not land you into a hospital. Even the urea levels, unless and until the patient is very weak and the urea is very high, like above 300, then only we need to take the patient to hospital for that. But any rise of potassium may cause the patient to go to a hospital or to get dialyzed immediately, because at times the potassium, even when we give potassium binders, even if the patient is taking potassium binders, then too the potassium levels do not come down, and it leads to palpitation, disturbance in blood pressure, several other things they might be. So potassium is one thing which one should be, the doctor should be very, very careful about. There was a child, he was 8 years old, and he was having this renal failure. His creatinine was around 4 or 5, and he took just a tetra pack of fruity. He asked his parents, and since he was improving, he was all right. He took that fruity. He asked for that, and he took that, and the patient collapsed, and he had to be rushed to emergency, and he could not be saved. So a tetra pack of 20 rupees of fruity took his life. This is the role of potassium. And as homeopathic doctors, we should be very, very careful regarding that. Some other time in some other webinar, when we'll be discussing the diet and the rest of the parts, we'll discuss in detail about it, why the potassium rich foods cannot be given at all. Then again, the sodium. Also, obviously, if the patient is taking excess salt, we have to ask the patient how much of salt are you taking and what kind of salt are you taking. Because sometimes the patient takes lower salt. It leads to rise of potassium in the blood. Sometimes patient takes this rock salt, sendha namak, or the pink salt. Different kinds of salts are available, fancy salts. But we cannot ask the patient to take them. The patient has to stick to common table salt that is available in the market, that is what is normally being used. So the potassium, again, now the sodium levels again have to be managed, because it is indirectly, it leads to high blood pressure. Apart from that, the urea level, obviously, it is as important as creatinine, rather more important, because creatinine does not cause symptoms. Usually, it does not cause symptom in itself unless its level is very high. But the creatinine is non-toxic. It causes symptoms only in some patients who are hypersensitive. I have seen patients with creatinine as high as 20 or 23, and they had no symptoms at all. While at times the patients come where the creatinine is 4 or 5, and the moment it reaches 7, the patients start to feel nauseatic, or they do not have appetite and all. So urea is as important as creatinine, and urea is obviously toxic. Its high levels may lead to encephalopathy, which again is an emergency. So this was all about few things about this. Another important thing is the blood albumin levels, because if the patient, which usually happens in diabetes, that the patient starts to having albuminuria, and they start to pass protein or albumin in the urine, and the blood albumin levels, they decrease. So what happens is, if the blood albumin is decreased and it is not supplemented, there is water retention in the body. The urine becomes the urine output becomes lower, and there is immense swelling in the body. And the moment you supplement the albumin by means of albumin transfusion, or usually we go for this egg white. The patient is asked to take egg white in moderation. If the albumin level starts to rise, automatically the urine output increases, and there is reduction in the swelling. Another important thing is the TSH, the thyroid stimulating hormone. It is not, not connected to kidneys directly, but the rise of TSH, or if the patient is in hypothyroidism, all the functions, they start to decrease, and so there is reduction in the filtration of creatinine as well. That happens with gross hypothyroidism when the TSH is really very high. But if the TSH is high and we are not controlling it, if we are not taking care of this hypothyroidism, then the lipid metabolism, it gets disturbed, and the triglycerides and the cholesterol, it accumulates in the body, and again it can lead to several cardiac complications as well as high blood pressure. So there are a lot of things which have to be taken care of while treating a patient for suffering from renal failure. Now moving on to the next thing is the urine. Urine has to be checked regularly. It can be checked more regularly than the blood, because blood has to be taken out every now and then. It becomes very problematic for the patient. But urine can be checked with more regularity, and urine has to be assessed for these few things, that the urinary albumin, which is denoted as plus or 2 plus or 3 plus, like that. Then there is pus cells. Usually, pus cells less than 5 are taken to be normal, but any value of pus cells, I mean, if even if it is 6 or 8 or 10 or 12, the homeopathic doctor has to pay attention to that, because it may be starting of a UTI, and if it is not taken care of, I mean, there's no need to give antibiotic right there and then. But we have a lot of homeopathic medicines like Canceris, Apis, Parera, and then Stephysagria. There are a lot of other medicines as well. So they can be taken, they can be given, and the urinary tract infection, which is in very initial stage, it can be taken care of then that very moment. Then there is this specific gravity, which in renal failure patients, it is low and fixed. So if you are getting this specific gravity, its value is low and it is continuously like that, it is not fluctuating, it is always low, then it can be an indicator of loss of renal function. Then this pH is very important, the urinary pH, because again, dehydration, excessive use of diuretics, it may cause disturbance in the pH of the urine. And the most important thing is the RBC in the urine. If again, I would say that if the RBCs are little higher than normal, it should ring the alarm bells, because it might be an indication of several things. And especially sometimes what happens is, if the patient is drugged, if the patient has already taken a lot of antibiotics and then they come to you, then they might not be rise of pus cells at all. They might not be, there might be urine infection, but they might not be pus cells. There might be just few RBCs. So then is when we usually go for culture, and it should be taken care of. Then another important thing is the total fluid intake and the measurement of the urinary output. Now, if the patient is not on dialysis, then the urinary output can be measured. The patient is asked to pass urine in a 1 liter bottle if they don't have a measuring flask or something. And they are asked to keep on checking it every 15 or maybe 20 or 30 days. And if you're giving homeopathic medicines like Eposinum or Barovia or Apis and all, then there is increase in, if there is an increase in urinary output, or if there is any improvement in the flow of the urine, then that can be assessed only when the patient is measuring it, if the patient is keeping an eye on that. So once in a while, definitely you have to tell your patients that it needs to be checked, and the total fluid intake also needs to be checked. Like if they are drinking from a bottle, it should be like measured, how many cups of tea they are taking, how many bowls of dal they are taking. So all these needs to be recorded, and accordingly they have to be counseled regarding that. If the patient is on dialysis, then there is a watch to be kept on the ultrafiltration, that is the amount of fluid that is being taken out from the body during dialysis. So if the patient is improving, if your medicine is working, if homeopathy is working, and the patient, the nephrons are being revived, so what happens is that the ultrafiltration, the fluid removed during dialysis becomes lower and lower and lower, and the urinary output, it increases. So, but you will be able to come to know of that only when you are keeping an eye on that. So the patient, usually they keep a diary or a record or something, but you have to keep on asking the patient that how much of ultrafiltration was done today, how much more fluid was removed today during dialysis, or what was the difference in the weight before and after dialysis. So if it was initially, if it was 1 liter and now it is just 500 ml, then it means improvement, and then the frequency of dialysis may be reduced. Another important thing is smoking and alcohol and all the addictions that the patient is dependent on. The patient has to be counseled to stop using all of that, because it is we already know that smoking and alcohol, how detrimental they are to health. Then the patient, no matter how much they are suffering, even if the patient is on end stage renal disease, still they have to be counseled to um, do some light exercises and some sort of breathing exercises, even if they are bedridden. Because it improves the circulation, and there are several hormones which are secreted, which bring about healing and which are secreted when a patient is into exercise and all. Then stress is something which leads to this blood pressure, the diabetes. The stress is the main cause of all these kind of diseases, and obviously it leads to the stress is only leading to this renal failure in most of the cases. So the patient needs to be counseled for meditation and good sleep, because
Okay.
the regeneration of the cells will only take place
Yes.
if the patient is getting good amount of sleep.
Okay.
And definitely the meals of the patient, the food the patient is taking is as important as medicine or as the rest of the management, which we'll discuss sometime later.
Okay, right.
I want to ask you, the lower potencies and higher potencies we can use, but which one is more useful and more convenient? I think that it is safe, because while we are using higher potencies, we know that now we are thinking about nanotechnology and everything, but our medicines are very nanoparticles are very small, and we can use it properly. So
Yes.
what is your opinion about it?
Okay.
See, I have found LM potencies to be the best. That is the first thing. But if I don't have LM potency of some medicine and I have to give, like there is a patient of nephrotic syndrome. So the first time I saw him, he was just like a balloon. He was swollen from everywhere. His eyes, but barely visible. His limbs, his tummy, everything was just like, swollen like a balloon. So I started with Hepasulf 30, and just now I'm giving him in CM.
Yes.
In the process, I've given him, so he is much better. There hasn't been an episode of nephrotic syndrome. I mean, that way. His creatinine is coming down gradually. He's much better. But there cannot be just one type of potency, the decimal or the centesimal or the LM, which can be, or the tinctures which can be used. There are different potencies, but I have found the LM potencies to be working really well.
Thank you, madam.
Okay.
Thank you.
Yes, that's an important words of wisdom and experience. Now, Dr. Hariharan, sir, once again, sir, please unmute, sir. Yes, sir. Yes.
Sir,
Yes.
one of my doubt is, see, Dr. Manoj is very said that, see, it is a miasmatic disturbance. I think it is an artificial disease. I think it's a certain kidney disease, because due to intake of this allopathic drugs, see, a drug disease is happening.
Yes.
But and it is affecting the kidney.
See,
Yes,
lifestyle
so,
is more important. Lifestyle is more important than allopathic drugs, actually. So it is, you are very right that it is an artificial disease, but the lifestyle is, our lifestyle is leading to that. Lifestyle is more responsible for that, creating that artificial disease.
Okay.